am designing a life the way I want to live. And that's why I decided not to go back to clinical dentistry, but to take my knowledge and what I know and share it with doctors to help them do the best for their patients.
Hello, everybody, and welcome to the latest episode of the Raving Patients Podcast. As you know, I'm your host, Dr. Len Tao, and I want to thank the sponsors of the episode, Cloud Dentistry and the Doc Sites, for putting their support forward to allow me to do this. So today's episode I'm really excited about. It's called The Snoozologist Tells All. I'm interviewing Mona Patel, a former fellow Philadelphian, solo practice owner, and now a Floridian. We are both Floridians. We're going to be talking about how she is helping dental practices with sleep. So, Mona, thank you so much for joining today, and welcome to the Raving Patients Podcast.
This is so awesome to be here. And I'm a true Floridian because I actually have a Floridian license with dolphins on it. So yeah, I'm excited.
We have not gotten customized licenses. My wife is a huge shark fan, so we're going to probably get sharks on our license next time. But we missed it. It has to be done on your birthday or something. And if you're not, you have to wait till the following year. It's a little bit complicated down here. So I have known Mona for a long time. We were just talking about it. I think we met in 2010, 11, or 12, one of those years.
I think 2010.
2010, yeah. At an Eastern Dental Society meeting in the Buck Hotel.
Yeah,
and,
Bucks County Dental
Bucks
Society.
County,
Yeah.
Pennsylvania. Yep. Howard Fran came in and was a little bit rude and obnoxious to the attendees and pissed a couple of people off like he did. But Mona and I met. Yeah. Mona was one of my very first clients for iSocial Dental Consulting back in the day. And look where things have. We end up, I'm in Parkland. She's in West Palm or Palm Beach.
Palm Beach Gardens, yeah.
Palm Beach Gardens, Florida, not far from where I am. So we've reconnected after, we've been in touch with each other over the years, but we reconnected to record this episode, and I'm excited. So Mona, for those that don't know who you are, why don't you give a little bit of a background, tell people how you're helping practices now?
Sure. Well, I've been in dentistry for 30 years. I've been a practicing dentist for 30 years, but up in Philadelphia. And recently, I really got involved in dental sleep medicine. And the reason being, I was diagnosed myself. So after 10 years of feeling super tired and super fatigued and having issues with my health, I got a diagnosis. And of course, at that time, I was 48 years old. And there was no damn way that I was going to wear a CPAP. It's not sexy. And I still wanted to be able to sleep in the same room as my husband. So I made myself an appliance and I felt better. And when I started to see how it impacted my life, I took it to my patients and my loved ones and my team. Next thing I knew, it opened up a whole new door in my restorative practice. But what happened was, as I started to go to courses and do curriculums, you know, when you go to these courses, you start to compare notes every time you go to session 1, session 2, session 3. And what I realized is that a lot of my colleagues were like, well, how come you're doing that already? How come you're doing this already? And one of my strengths is that I'm a great implementer. And I had a system and I started to help people. And then COVID happened. And I was on my phone, and my husband and I had been married for 28 years at that time. And we're walking, and my husband's like, babe, I have to ask you, we've been married for so long. Do I have to worry? And I'm like, what are you talking about? And he's like, you're always on your phone. And I'm like, oh, yeah, I'm answering questions on sleep. Right? And he's like, what do you mean? And I'm like, all these people just are reaching out. And he's like, oh, well, why don't you just go help them? And I'm like, what do you mean? He's like, just go, like, you had coaching for practice management, for social media. Why don't you go to their offices? And that's where Dental Snoozology was born, where I go in to help the team, the dentist, but really the team actually implement all the steps they need for a customized workflow in the offices.
Well, that's really great. You sold your practice in Abington. When did you sell it?
I actually was so fortunate. I sold it December of 2019.
So right before COVID hit, you worked in the office through.
Yeah, as an associate till October of last year, October of 2021.
And then she moved to Florida. Now she's down here. Very similar to me. I've obviously have a lot of things that I do outside of dentistry, and I used to go into office. I don't do that anymore. but I speak all over the country. So.
Yeah, but wait, Len, remember when we first met? And I was like, Len, I want to be like you when I grow up.
Yep.
Right?
I do remember that. And I went into funny thing is I went into your office as a consultant to teach your team how to implement the things that we were trying to do. So it's kind of come full circle here. Now you're going into offices.
Yeah.
You're speaking around the country. So you're just like me, and you're a little bit older. So that's good. But I'm in a similar boat. I sold my practice. I'm still working till the end of this year, December of 2022. I will be done clinically, and I will be not going to Philadelphia clinically anymore. So that's a big change for me considering I travel so much. So let's talk about a little bit more about how you're helping practices. So I understand you were diagnosed with sleep issues. So why don't you talk about, a little bit more about your journey into dental sleep medicine, why you decided to do this and everything else?
Yeah. So it was, I knew sleep was, as I was evolving in my dental career, as you start to do comprehensive dentistry, there were things that were falling into place for me. However, there was something missing in the jigsaw puzzle of occlusion, teeth, muscles, and, really broken down cases and patients who were just totally non-functional. And I knew that maybe sleep was part of it, but it was on my list and I never got to do it. And in that time, during that decade in my 40s, I was struggling with my health. Like as a mom, as a female, you're a mother, you're a wife, but you're also an owner of a practice. You're a leader of your team. You're running this business. And I was fatigued. Like I literally would go home and I couldn't do anything except sleep on the sofa for 3 hours and then not be able to provide proper dinners for my family. It would be all like ordered out, right? And the guilt and the depression that came with it, and the fact that then I was saying no to all these great opportunities and experiences because I was tired. And what happened was, at the same time I had been diagnosed with a thyroid issue, and then even though I was exercising like crazy because I didn't want to put on weight because I had a thyroid issue, I was now pre-diabetic. And all of these things were adding up. And then menopause hits, right? And my husband, who loved my quiet purring, right, or my heavy breathing, was suddenly like, I can't sleep with you anymore. And I'm like, why? He's like, you snore. Like, you snore. And I'm like, no, I don't. And he's like, yeah, you do. To a point where I wouldn't believe him, and we would have fights in the morning. I'm like, I don't snore, you snore. What are you talking about? Like, stop being an asshole, right? And then my girls recorded me, and I snore. And at that time, I actually went to finally, I'd gone and signed up for a sleep course, and I went to a course, and they were giving out sleep tests, and I was diagnosed with mild sleep apnea. At that time, I stopped breathing every 6 minutes. I had a HI of 10. That meant that every hour, 10 times an hour, I would just go, and then I'd stop breathing again. That fragmented my sleep, but actually started to cause disease in my body as well, connected to all of that. So, okay, what's the next step? Like I said, I'm not going to wear a CPAP, right? No. So I made myself an appliance. And within weeks, I started to feel like a different person. I've been wearing an appliance for a few years now. And in actuality, my dose for my thyroid medication got halved because my numbers are so great. And that I think is to do, I know it's to do with sleeping well. So anyway, I made myself an appliance. I started to learn more about sleep. I went to foundational courses. I went to mini residencies. And what I realized is that they're giving you the science and they're giving you the theory and all of that. But I had to come up with a whole system myself to be able to implement it, to be able to take my team along with me, because this was so super important. I don't want it to fizzle out because this was actually going to help people. And that's how my journey into dental sleep medicine started.
I've always been told that I have the symptoms of sleep apnea, but I've never been diagnosed. I've actually taken a sleep test and I didn't have sleep apnea. But there's something about my eyes. Whenever I would go to the optometrist or the ophthalmologist, they would ask me, there's a fold in my eye or something that's indicative of someone with sleep apnea. And I'm a heavier guy, but I don't have sleep apnea. I've been tested. And my sister, on the hand, my sister is very, very, she's on the highest level. She could not wear a CPAP though. She tried it and she couldn't do it. And so she's trying to come up with some solutions herself. That's really great. But, I want to take one more step back after that, is that you are newer into the education space. I know that you had taken classes through John Nasty and Jason Olitsky.
Yeah, with CMS.
Had CMS, yes. And you did some work with them as afterwards talking about sleep as well. That's how you kind of got started, I guess, correct?
Well, actually, but I started doing that clinical mastery curriculum in 2016. And in 2017, they asked me to be a mentor, because what they do is if they see a doctor doing the work, like I went to a full mouth rehab course, and, the next month I did 110 units of comprehensive dentistry. They're like, yeah, okay, this person she gets it, right? So after a year of going through a lot of the curriculum, they invited me to be a mentor. And that's when I got my first taste of what it would be like, what it looks like to help people. And that's one of the things I love to do. I know it sounds goofy and nerdy and all, but honestly, my biggest happiness comes from helping people. That's just how I made up. So when I started to help doctors move from being stuck in a certain place with their dentistry and moving them into how to shift their mindsets and their perspectives and their teams to do comprehensive dentistry, it was awesome. But at the same time, I got interested in sleep. And then I went on this whole journey where I took a break from, mentoring for about a year. And I did up to 100 hours of CE in a year on sleep. And when CMS needed someone to do sleep, they had someone, and unfortunately he got sick. He was amazing. His name is Sam Kress, and he was one of the first courses I did. They asked me to step in, and I started teaching with them. So, and then I also teach with Awaken to Sleep. I do their virtual courses, and thanks to what I bring to the table, they decided that they also wanted me to come up with a clinical virtual course. So now we're launching. In May, will be our first virtual clinical course, where we take the introduction foundational courses a little bit further.
I think that's awesome. I think the journey is awesome. You found a need. You found a passion outside of what you were doing in clinical dentistry, and you've taken it to the next level. So, seeing that from the outside and knowing that I did it myself, I give you a lot of props. I give you a lot of credit for being able to do that.
Thanks, Len.
Yeah. So let's. I want to shift gears again, and I want to talk about something that's near and dear to my heart, because you are done with dentistry completely. You're not going back
with clinical dentistry. I think I'm done. I didn't think I was when I made the move. I moved to Florida 6 months ago, and I thought, I'll take a little break and I'll go back to licensing. And honestly, I'm okay. 30 years of practicing and giving, my love to my patients. I'm okay now not to do that anymore.
No, and look, so as we share a very similar story there. As I sold October 1st. I was working. The new owner, who's a great dentist, is back in the practice now after maternity leave, and I told her that I'm done December 30th, or whatever the last day of the month. My working would be December 20th or 21st. It normally is, and then I'm not doing clinical dentistry anymore. And I've spoken to some people about that. Just as recently as this weekend at a seminar I was giving, and they were there giving a seminar as well on owning a DSO, because he doesn't practice dentistry anymore. And he said there was a very dark time he had for a few months there when he decided to give up his clinical practice, where he wasn't treating patients anymore. I'm not the owner of my practice anymore, but I'm still clinically treating patients, something that I've done for 22 years now. So did you find a time when you were done, when you said I'm done, where that happened to you, or your last patient you treated? I'm curious, because that's an interesting perspective. Only because people told me it was going to be difficult to go from owner to associate. Okay, now you sold to a DSO, I sold to an individual. My transition from a owner to an associate has been easy. Okay, easier than I thought it would be. I just go in, I do my work, and I leave. I don't have. There's things I do because of who I am that I still do. But it's really interesting. So I'm curious what your thoughts on are from when you actually said, "I'm no longer doing clinical dentistry," for people out there who are thinking doing something similar.
Yeah, absolutely. It's a journey. You'll know when it's the right time for you to make a move from ownership to being an associate or stepping away completely. But one of the things I realized for me was the dark time was when I actually sold my practice and became an associate. And it wasn't about who I sold to. It was about the fact that I had lived so much of my life with my identity mixed up with what I do, right? So my identity at that time was I am Dr. Mona Patel, owner of Dr. Mona Patel, DMD, LLC, a fee-for-service practice for 26 years, right? And that was the reason I struggled, because my identity was that. And what I realized then is it's very important to understand that don't make who you are what you do. And it took me a few months to realize that, wait, I'm more than that. I'm Mona Patel. I'm Mona. And I'm freaking phenomenal. And I've got now options of doing so many things. Life is an adventure. But it took me that understanding to realize that my identity is not fixed to what I do. It's to what I am. And once I understood that and I gave up that connection, like I just found myself, like I'm like, hey, gosh, that darkness lifted. That feeling of like I gave up something so much, it lifted. So for anyone who is going to sell or is stepping away from their associateship to retire, work on that part. Work on who you are and make sure you know who you are and not have it connected to what you do.
I know you said that it was harder for you when you sold the practice and became the associate. What about making the decision? I know you said it was hard, but making the decision to stop dentistry and now, from what you're saying, not going back anymore and just focusing on this part of your life.
That for me was a lot easier because I'd worked out what I was talking about before. But when I also was working for a DSO and then COVID happened. And the DSO that I entered my agreement with was great. And then COVID happened and things changed and their people changed. And the way that the practice was running was just not in alignment with how I was. And I was able to remove myself from my contract, which was great. And once I did that, I just felt like very free. And when I moved to Florida, I was considering getting relicensed, but I really sat down and I'm like, how do I want to vision my next few years to be? Here I am. I'm going to be 53 this year. My kids are out of the house. I have a 26-year-old and a 22-year-old. And I'm like, what do I want from this decade? It's a bonus decade. Nobody needs me. My mom's doing well. My family's doing well. My kids are out of the house. Whew. So I am designing a life the way I want to live. And that's why I decided not to go back to clinical dentistry, but to take my knowledge and what I know and share it with doctors to help them do the best for their patients. And my thing is, if I impact one person with what I teach and they save one life, it's a ripple effect. It's going to have so many great consequences. So that's the place I'm from.
No, and I agree with you 100% there. I give a class or a little seminar I call Don't Sweat the Small Stuff. And I talk about my journey and I talk about how I built this amazing practice. I bought a practice, I built it. And it's a beautiful practice. It was a beautiful practice. So I had the practice of my dreams, but I wasn't living the life of my dreams. I was in the office, all the time. I was, stressed out to be because of the debt service I had and everything else. And I needed to find something else to do, which I did, obviously. And now that I've transitioned out of ownership of a practice, and soon to be not doing dentistry and moving to Florida, building a new home here. And, how you go out in my backyard, it's like a paradise out there. I finally say that I'm living the life of my dreams. So our journeys are very, very similar.
Very similar. And when you say that, I have to tell you that at the age of 48, like I woke up one day And I looked around and I'm like, oh my God, I have like a practice that's amazing. It's got the technology, like it's amazing technology. I'm doing great cases. I have a great husband. My kids are growing up. They're doing well. I feel stressed all the time. I'm not enjoying what I created. Right. And that was that time where I realized I've got to figure out who I am, what do I need to do to live the way I want to live. And, I know that there are some people who I used to say to myself, I'm so passionate about dentistry. And then that 3-month break during COVID where I didn't do dentistry, I realized that, yes, maybe I was passionate about dentistry, but not as much as I used to be. Or maybe that was a story I was telling myself so that I could keep going in every day and doing what I did. And that was a huge change for me.
I think that's great. So the other thing I know that you're very much involved with is charitable contributions. So can you talk a little bit about that as well?
I always wished that I had more time to give to help people. So when I came up with Dental Snoozology with my husband, when I go in to help people, when they hire Dental Snoozology, 33% of the net profits will go to charity. And it's about educating young girls. So it's the Malala Project, where it will go to help educate young girls who don't have access to education. Because for me, education is so important. My dad, being Indian, right? Indian women have certain disadvantages. Not anymore, but like in the old days. But my dad was like, I'm going to make sure my girls are educated because if they marry an asshole, they can walk away.
That's great.
And, and that's what I want to give to young girls who may not be living in a place where they can walk away, where the only way out is to have knowledge. So that's one. And then the other is elephants. I love elephants. They're beautiful creatures. And so that goes to elephant conservation. So that's what I love about what I do, because now I get to give back.
That's really great. You mentioned elephants. So, Bird Eye is an Indian-owned company. We have a lot of Indian employees. And one of my friends within the organization has gone to India a number of times over the last few years, and she is obsessed with cows. And there's so many cows in India.
Oh,
she takes
that's
a picture
right.
of them, and it's like she's obsessed with them. So it's very funny you mentioned elephants. She's obsessed with cows. So
it's so funny. Yeah.
So I want to transition now to a section that I call kind of the lightning round Q&A. Okay, it's time for that. So I explained to Mona, and for those that listen to these podcasts often, I usually save about 5 minutes towards the end to just do a Q&A. This is called The Hustle, so it's going to be on business stuff. So very easy, Mona, for those that haven't listened to this before. I'm going to ask you a question real quickly, lightning round. You don't have to go into long answers. So first off, who has been your greatest inspiration?
Oh my God. Oh my Lord. Leanne Brady, when it comes to dentistry and women and clinical practice. Yeah.
Okay. What have you learned from the most successful person you know?
Take risks, be yourself, get out there, say it like it is. Len.
That's what I do. That's great. I like that. And I tell people like it is. It's either people love me or hate me because of that. So, what business related book has inspired you the most, or what is your favorite book?
I have two, the E-Myth, but the biggest one is Change Your Questions, Change Your Life, right? That is where it just helps you understand communication with your patients and your team, because so many dentists just take things so personally, and Change Your Questions, Change Your Life is huge in shifting out of that mindset.
I think that's great. So do you believe there is some sort of pattern or formula to becoming a successful entrepreneur?
Yes. It's actually being yourself first, being authentically yourself, leaping, taking the risk. And you know what? If it doesn't work, so what? You tried and you reinvent it and to something else to make it work. And yesterday I did a podcast with Andre Sheridan, and he actually said this, and it really touched my heart. He said, Mona, I've seen you over the 22 years I've known you, and you leap. And he goes, but you not only leapt, you grew wings and you kept flying and you've kept flying. And I thought that was really amazing. And I think that's what it is. You just leap and you grow wings on the way down, is what he said.
I like that. I like that a lot. So,
yeah.
So here's an interesting one. If you had to open up a lemonade stand tomorrow, what would you call your stand?
I am that I am.
I am that I am. Okay. How do you capture and keep track of ideas? Do you keep a notebook? Do you have voice memos? What's the best way for you to do that?
I text myself.
You text yourself.
Mm-hmm.
Okay. Do you have a favorite business podcast you listen to?
I actually listen to Jamison Spencer's Sleep podcast. I love it because it is all about dental sleep medicine that I love.
That's great. Okay. What motivates you?
Joy, happiness, helping people, gratitude, living in the moment.
Perfect. Do you make a to-do list every day, weekly, or when?
I do not. I use Asana. Asana has all my automated day-to-day tasks, so I don't even have to waste energy on thinking what I need to do. And anything that has to be done is programmed on there, and it keeps my mind empty of all the noise.
What would you say are the top 3 skills needed to be a successful entrepreneur?
Openness, risk-taking, and not being fearful. Having courage to just do it, to play, like Brene Brown said, play in the arena.
That's great. I love that. And then last one, what is the one thing that doesn't add value to your life, but you still do it?
Eat chocolate.
Eat chocolate. So is there anything else that you wanted to touch base on, let the listeners and the viewers know about Mona or Snoozology just before we kind of wrap things up?
Well, I will announce that I just recently came out of the spiritual closet. What does that mean? I'm an empath. A lot of us dentists are, a lot of our teams are. And being an empath, you tend to absorb a lot of emotions that are not yours. And I've been on a great spiritual journey the last few years. And what I've learned is how to harness that power. And I'm coming out to offer sessions on how to do that.
If somebody is interested in learning more about what you can do with from a sleep, medicine perspective, learn more about what you do for practices, or want just to find out if you can help them, what's the best way for someone to do that?
My website is www.dentalsnoozology.com. There are multiple ways to connect with me. There's book a Calendly call. You can email me. You can see me on Facebook. You can message me. You can see me on Instagram. Whatever is easiest for you, reach out. And I'm happy to chat with how, if this is something that you want to do. I will say one thing with sleep. You don't have a choice. You need to know how to screen your patients. It's up to you if you want to choose to treat. You can choose to treat. And if you choose not to, know who to refer to. But you have no choice in knowing about it and screening it because it's so important for your patients.
That's great. No, I agree with that. And it's one of the things I actually have wanted to do, but considering that I only have, a number of months left before I'm clinically done, it doesn't make a whole lot of sense for me to pick it up now, but it was something that I had on my list. And honestly, if I didn't go in the direction I went, in 2012, 13, and 14, I probably would have gotten into things sooner, but obviously my career took a turn, unexpectedly when I developed what I developed and ended up in the position I'm in. So, well, this was awesome, Mona. I think when I met you, I thought you were wonderful. I think you do a great job. I think, if people want to learn more about what Mona could do, reach out to her. She gave you the website. She gave you the way you can reach out to her on social media. You can schedule a call with her so you can figure out, if she can help your practice, which is most important. But thank you for joining me today. Everyone, if you like this episode, please share it. Please recommend it to your colleagues. Like us on Facebook, review us. We're trying to increase the viewership. We've been making leaps and bounds over the last, couple of months. I hope you like the content that we're creating. Remember, I also have a brand new book that I just released called 100 Plus Tips to Getting 100 5-Star Reviews in 100 Days. This is available on Amazon, so check it out if you want. And remember, our episodes come out weekly, 5 a.m. on Fridays. So check out the latest episode and remember to subscribe to them. Mona, you were great today. Thank you so much for joining me. Remember, your reputation matters. Thanks again, Mona. Thanks for everyone for listening.
Bye.